So the goal of our research is to understand the problem of alert fatigue, which is a phenomenon where when providers are presented with an excessive number of alerts, over a period of time, they start ignoring these alerts, even clinically significant ones. In the past, we focused on how to develop a minimum standard of a set of interactions which can be used across EHRs to generate critical alerts or clinically significant alerts. But in this body of research, we wanted to focus on how can we design alerts better, how can we present them in an effective manner to providers. And that really was the main goal of this study, which we tried to examine from various facets. One of the facets that we looked at was establishing a relationship between how well an alert is designed and the probability that it would be accepted or overridden. And we were able to establish a negative correlation, which is as the quality of your alert increases or as your alert becomes more and more well designed, we were able to show that the number of times a provider would override that would decrease. In another aspect of the study, we examined providers' perceptions about these alerts, and we were able to show that when providers felt that they were seeing too many alerts, they actually started regarding these alerts as less clinically relevant and less clinically significant, with the effect that they would stop reading them over the course of time. And this was self-reported data. In another aspect, we actually examined how providers interact with these alerts. So when an alert is presented in an electronic health record, what pieces of information does a provider need to actually act on that alert? And whether these pieces of information, patient contextualized information, was actually available in the EHR. We feel like all these different facets really contributed to our understanding of how we can design alerts effectively. And we were fortunate that we had participation from academic medical centers, from the vendor community. We had EHRs representing both inpatient and outpatient settings, and also some international EHRs, which really allowed us to draw our conclusions looking at a broad spectrum of alerts and identify characteristics across these alerts that could inform us about how to design them effectively. In the future, we've had a lot of interest from the vendor community, and what we want to do is collaborate with them, to make sure that these recommendations have farther-reaching effects.